The Aged Care Services Minister, the federal, says he's very comfortable with the pace of the COVID-19 vaccine rollout, despite the fact that more than 100 aged care facilities are yet to get their first doses. Residents and staff are considered the highest priority when it comes to getting immunised, and the focus will now turn to Victorian facilities due to the Melbourne outbreak. Political reporter Stephanie Boris joins us now from Parliament House in Canberra. Steph, so many older Australians are still waiting for a COVID-19 vaccine despite being at the front of the queue. This would probably come as a surprise to many people. What concerns have been raised?
Good morning, Joe. Yeah, the figures aren't as good as what you'd expect by this time of the year, given that the federal government initially said that people in aged care homes would be vaccinated by April. So the latest figures we have show that 2,451 aged care facilities across Australia have received at least their first dose of the COVID-19 vaccine. But to put that into perspective, there's about 2,600 aged care facilities across the country. As you mentioned there, aged care facilities, so both the residents and the staff, are considered to be part of phase 1A of the vaccine rollout, so therefore they are a high priority. Now, given what we've seen in Melbourne, we've got specific figures on what's going on in Victoria. So 29 aged care facilities in Victoria are yet to receive their first dose of the COVID-19 vaccine. We were told that 4 of those facilities were meant to get their first dose yesterday, but we haven't got confirmation of that yet. But obviously the concern is the fact that we saw last year there were outbreaks of COVID-19 in aged care centres, and unfortunately we did see people die in those facilities as well, hence why they are considered part of phase 1A. Federal Labor this morning has been out raising obvious concerns about this. The Shadow Health Minister, Mark Butler, says that some Australians are being left vulnerable and by now they really should have been cared for.
The idea that 29 facilities in Victoria, given all that happened last year, haven't even had a single dose is a scandal. But as well, there are several hundred aged care facilities in Victoria that have only had 1 dose. Now, to be fully protected, you need both doses. These people are not yet protected as Scott Morrison promised they would be.
And so, Steph, the federal government is in charge of the vaccine rollout in aged care homes. What's it had to say?
Well, quite interesting comments this morning from the Aged Care Services Minister, Richard Colbeck. He says that it's been a great effort so far in terms of the vaccine rollout in aged care facilities. And he's also put part of the blame on the slow rollout to the facilities themselves. He's arguing that with those that are organising the COVID-19 vaccine rollout, they have to liaise directly with the facilities. And some facilities have asked for a bit more time because they wanted to get their residents vaccinated against the flu. So therefore, you do need that gap between getting the flu vaccine and the COVID-19 vaccine. But overall, though, Richard Colbeck says that the rollout in aged care centres is going well. However, Victorian facilities will be prioritised as a result of this outbreak we're seeing in Melbourne.
Okay, Stephanie.
I'm very comfortable with the rollout of the vaccination across the country. About 85% of residents across Australia have taken up the vaccine, and it's been a significant logistical effort. There are some providers who have put back their vaccine dates so that the residents can get flu vaccinations, for example. So we've worked with the providers to schedule them over the last 12 or 13 weeks to get them vaccinated.
So, Joe, in terms of when all residents in aged care facilities will be vaccinated by, well, we do know that Victoria is now being prioritised, and Richard Colbeck says the remaining aged care facilities should receive at least their first dose within the next few weeks. On top of that, in terms of specific help for Melbourne, the federal government has announced that an extra 40,000 doses of the AstraZeneca vaccine will be sent to Victoria this week.
Okay, Stephanie Boris there in Canberra.